Hi, I'm Dr. Jennifer Sampson, and I'm Executive Director of the Hoarding Project. One of the questions that I commonly get asked are, what are some of the safety and health risks associated with hoarding behavior? One of the main safety risks that comes across in hoarding situations is a fire hazard in the home. Now, not only are many entrances and exits blocked to homes in hoarding situations when there's a lot of stuff involved, making it difficult for people to get in and out in the event of a fire, but also that there's an increased fire load in the home. When there's so much stuff in a home, we have an increased load or quantity of flammable material, books, papers, things like that, near heating sources that can catch on fire, but it's also easier to spread as well, making it then, of course, more difficult for firefighters to respond and put out the fire in the event that one starts. We also have an increased risk of falls in the homes, or then items falling on people as well. Walking through pathways becomes very difficult, and people become very unsteady on their feet when they're walking on top of things like clothing, books, papers, things like that. Additionally, lack of routine home maintenance is very common. Common household chores, including vacuuming, dusting, changing light bulbs, become difficult, if not impossible, in many hoarding situations. Structural damage to building is also a possibility. When items with increased weight over time have been sitting in rooms that may be affected by water or just the structural load of the building becoming impaired or jeopardized because of the amount of stuff, that can become a danger to people living in the home. There's also a risk of eviction or homelessness that happens in hoarding situations, an increased risk. If you are a renter or if you are receiving any sort of subsidy from the government to make housing more affordable, you're subject to at least an annual inspection of your home, which of course, if there's hoarding going on, people are at an increased risk for failing this inspection and then potentially becoming homeless as a result. There's also an impaired functioning across the board that can happen in terms of other health risks associated with hoarding. Poor hygiene or grooming, basic nutrition, tending to those needs become very difficult in hoarding situations. Things that are already difficult to manage, such as attending to medical needs, financial management, can become extremely difficult or next to impossible when hoarding is layered on top of it. Sleeping can become compromised. Oftentimes individuals in hoarded homes are not sleeping in their bed, or if they are, they may be sleeping on top of piles of things or next to piles of things, which of course affects the quality of a good night's sleep that they're getting. Levels of mental health, depression, anxiety can all be increased or exacerbated when living in cluttered or hoarding environments. We also have other increased health problems because of the presence of things like mold, bacteria, or dust. Asthma and allergies are increased in individuals who hoard. We have an increased risk of rodent or insect infestations. And if there is squalor present, like there's animals in the home, or utilities may not be working, there may be a presence of animal or even human urine or feces that of course can spread diseases. So these are just a few of the safety and health risks that are associated with hoarding. If you have additional questions about hoarding, please visit our website at thehoardingproject.org and check out some more frequently asked questions. Thank you.